Hello everyone, my name is Oluwole Smile from Center for Health Economics and Development, CHECOD, the technical partner to Federal Ministry of Health and Social Welfare in the development and implementation of Health Sector Annual Operational Plan. I welcome you to this session on how to use the AOP Resource Mapping module. The FMOH AOP architecture is designed around alignment principles of one plan, one budget, and one report, creating a unified platform for one conversation and continuous day-to-day dialogue for alignment, accountability, and optimal health outcomes. The resource mapping module is what operationalizes the one budget principle, which is the nexus between one plan and one report. If we can get the financing right, both provision and consumption of healthcare goods and services will be right. So this resource mapping exercise helps us to bring both partners and government in the same room. And that is one of the things that is new in this phase, this year's planning cycle. As you can see in the order of the AOP process, we have the resource mapping in the activity 3B, whereas the activity development and costing, is under activity 3A. So before now, activity development, costing, and resource mapping were done simultaneously in a single meeting. But now, based on the advisory note from the Federal Ministry of Health, in collaboration with SWAP Coordination Office and the Department of Health Planning and Statistics, the advisory note has really emphasized that the resource mapping activity should be a standalone leadership-driven exercise. And this will be led by the director or the head of the agencies, together with all partners in the room by allocating resources against the identified priorities. This will help us, mitigate the weaknesses and inefficiencies within the, AOP planning system or process that we have seen thus far by having, costed plans not aligning with the budget proposals. So all of this will help us, address this issue of misalignment, fragmentation, and overlapping issues. So if we're able to ensure that this resource mapping activity happens at the time we have completed the costing and the activity development, it will help, engender greater transparency, stronger accountability, better alignment, reduce fragmentation, and better results. Finally, before we go into the tool, the government commitment identified in the AOP through resource mapping will automatically be populated in the budget preparation module. That is the next session of this module, of this presentation, where you will see how all of these are aligned with the standardized chart of account framework. But in this module, we are focusing on resource mapping, where government and partners, express their commitment against the identified priorities and activities. And like I mentioned earlier, it is expected that government commitment must be translated into budget proposal for executive and legislative approval. So now let's go into the AOP tool to demonstrate how to go about this. This is the web-based AOP platform. To go to the resource mapping module, you will click on these three dots, and then you come down and click on AOP Resource Mapping. That's how you navigate yourself to this interface, which we are currently on. So this is the resource mapping module interface, and you can see from the first three columns, the activity code, the operational activities, and the budget for the activity, that is the cost for the activity, automatically pulled from the planning matrix module and ingredient-based costing module. So they will be waiting for you already in the resource mapping module. All that is needed to be done is for government and partners, in the room to review the identified priorities and activities and the corresponding budget, and then start allocating resources based on the policy priorities. So if government want to express their commitment, you go to the this pencil, go to the government column, and then click on this pencil. Then you will see the entire resource mapping form. So here, for this activity, procure and install facility-specific solar PV system for 5 primary healthcare facilities at the cost of 8 million. Let's assume government is going to put down like 5 million. Then we type 5 million, right? So government has expressed its commitment, since the whole process is about joint planning, joint budgeting, right? So then the partners also that have resources against these priorities needs to align their commitment. And for every implementing partner, there is a funding source, which is the donor. So we need to identify the donors and then first of all select it in a drop down. For instance, let's assume that LAFIA program is interested in this activity and part of their scope is to align with these priorities. With this priority, then LAFIA program has a funding source from FCDO. So you click on FCDO, and then the name of the implementing partner is LAFIA program. So you type LAFIA program. LAFIA program, that's the name of the implementing partner. It could be WHO as implementing partner. It could be CHI. It could be CHECOD. It could be Solina. It could be those partners, SFH, that are available at that level of implementation. So once you have typed the name of the implementing partner, then you come to the amount in here. Let's assume they are putting in 2 million for this activity. 2 million. Okay, great. So that is the first implementing partner. So if there are other partners that is also, and we know that still funding gap, there are still other partners that want to align with these priorities. This is where they also select the name of the funding source, the donor, and also the implementing partner in the room, and then their amount. So this will also go on as many partners that are available in the room. So after you have allocated all the resources, both from government and partners, the next thing now is to click the submit button and wait. I will click the submit button now. Great. You can see now that we have the budget that have been pulled from the ingredient-based costing module, and now the government commitment, which is 5 million. And we have always emphasized that as we make this commitment available, let's ensure it gets through the budgeting process for executive and legislative approval. Okay. And then from the partner one, LAFIA program, they've expressed 2 million, and we'll be able to identify the funding source, which is FCDO. And then at the end of the day, we will see in the second to the last column, we will see the total development partners support, which is 2 million, and then the funding gap, which is 1 million naira. So this also helps us to identify the unfunded and underfunded priorities in the AOP. Lastly, before we round up, there are some activities that attract no cost, just like a planning meeting that can be done in the conference room in a state or at the federal level. That must have been indicated during the activity development in the planning matrix module. So if you have indicated at no cost, this is how it will show. So you will not be able to allocate any resources against those priorities. So this is all about the resource mapping module, and then let's round up with our final recommendation. As partners and government, we be held accountable for financing priorities. We should ensure that more resources are directed to priority interventions and activities for optimal impact. And this should be done in a coordinated, transparent, and accountable manner. Thank you.